For over 40 years, the West Virginia Primary Care Association has been a crucial source of hope and help for communities across the state.
My name is Sherry Farrell, and I serve as the President and CEO of the West Virginia Primary Care Association. Community health centers are truly a part of the fabric in their communities. They are patient-directed healthcare organizations, representative of the community served. The PCA, we are working with health centers as they achieve their goals of high-quality, accessible, affordable health care. And so we walk this evolution of the healthcare system with them through leadership, through advocacy, through our programs and training and technical assistance. We are a trusted partner to our health centers, and we've proven that over the past 40 years.
Primary Care Association grew out of a need back in the mid-70s to develop primary care, and it started out with a study group, a group of individuals who were at health centers or community clinics so that they could learn from each other.
The second objective was to be kind of a singular voice in the state to make sure that policymakers understood the value of community health centers.
We had a lot of legislative involvement, pounded the doors and walked the halls, and we worked and worked. The excitement that I have seen over the years as we have grown from these small clinics to where we are today. The change is unbelievable.
We're serving over 500,000 West Virginians, a third of our state's population. These people are choosing, right? They are choosing to receive their care from a community health center. And I think that just goes to show how health centers have really embedded themselves as a trusted healthcare partner. Health centers have to have patients on their boards, and they help make sure the health centers are meeting the needs of the communities that they're located in. For example, in southern West Virginia, we have several health centers that offer pulmonary rehab because we had a prevalence of black lung. But then you can go up to Parsons, and in their area, what their community needed was cardiac care and physical therapy. When we think about health centers, that goes hand in hand with access. So in a state like West Virginia, with all of our hills and valleys, so it's actually making sure that there is high quality care where you are.
We provide care to everybody regardless of their ability to pay, have sliding fee scales.
Making sure that our most vulnerable, our underserved people, everyone has access to high quality healthcare services.
We provide services across the board, from physician services to dental services to optometry and pharmacy.
So your whole lifespan, you can stay with your health center as your trusted partner. Our school-based health centers, that is a big piece of the work that we do. Over 100,000 kids have access to these services.
School-based health centers, they're available for urgent care needs, providing preventive health visits. And then in addition, the programs are there for the teachers.
I believe that we are more than just an association. We're actually changing our communities.
That vision that we have, that we've always had, has pretty much come true. It's fantastic.
I feel gratitude for having the opportunity to do this. There's also kind of a recognition that there's so much more to do.
We stand on the shoulders of others, and hopefully someone will stand on ours, right? As we keep building, as we continue to move the continuum of care in West Virginia, patient by patient, community by community.
For over 4 decades, the West Virginia Primary Care Association has been at the forefront, uniting and enhancing the work of community health centers across the state, transforming primary care into a promise kept, a right upheld, and a legacy built for a healthier tomorrow. The West Virginia Primary Care Association, one mission, one vision, one voice.